I recorded it to the cloud.
Perfect, thank you. I guess we're ready to start. We have 36 people. Thank you guys for being here and welcome to the Global Service Panel. This event, as you know, is part of the Study Abroad Fair Week and hosted by the Center for Service and Learning. My name is Lidiane Castro Gregory. You guys can call me Lidi. And before you start to wonder, yes, I am from Brazil. I am the Academic Community Engagement Coordinator for the Center for Service and Learning. And today I will be the facilitator of our discussion, and I'm excited about this. We also have another people from our office that I would like to introduce to you. The first one, Carrie Berner. She's our awesome iService specialist, and I do believe some of you already know that face. She's really great, and today she's taking care of the logistics here. We also have Catherine Whitworth, and if you want to say hi, Catherine, she's our community partner coordinator, and we work very closely. And the last one, we have Eric Murphy. Also, some of you might know him. He's really great, and he's our associate director. He's also joining us today. Eric, do you want to say a quick hi?
Hello, everybody. Lidi, I look forward to this great event. Everyone, if you ever need anything, please give us a call at the center. We have multiple resources available to you.
Awesome. So before we start our conversation, I just want to remind you that you are all muted, but it's just for the first part of the conversation. The last 15 minutes of this call, you're going to be able to engage and ask all the questions that you have, but just wait until the 15 minutes and we're going to open the mic and you're going to ask your questions to our panelists. But I do encourage you throughout the talk to use the chat box that you just tested, and it's working just fine. So if you have questions and you don't want to forget your questions, make sure you type in the text in the chat box and also your comments. Now, without further ado, we are all here ready for this. Let's get things started, and I'm going to present to you our awesome panelists that we have here today. Let's start with Christina White. She's a biology and international studies student. She's an experienced traveler. In the summer of 2016, she traveled to Peru and Bolivia as part of a service and learning program with Amizade Global Service and Learning. Last year, she joined the WVU Global Medical and Dental Brigades, and she went to Honduras. This year, she was a recipient of the Guilma International Scholarship to travel to the Amazon region of Brazil. And of course, that didn't happen because of COVID. The trip had to be canceled, and I'm hoping that she will speak more about that with us today. We also have Professor Daniel Brewster. He's a teaching instructor in the Department of Sociology and Anthropology. He serves as the advisor for both the Global Medical and the Global Dental Brigades. He has been the advisor of these organizations for over a decade, and for the last several years, he has led global service projects to Panama, Nicaragua, Jamaica, Honduras, and Ghana. That was a long list. And in a couple of places, he has been more than twice. So this is really great. And he says that he has served side by side with some of WVU's most brilliant students. I am sorry about that. Let's just do this. And last but not least, we have Micah Gregory in this call. He is the former Brazil site director for Amizade. He has led and facilitated global service and learning trips since 2010. And he also helped Amizade establish their global health programs and the multilateral partnership for interprofessional exchange rotation for graduate level health science students. As a former nurse, he has worked largely in project management in clinical settings, in riverlining communities on hospital ships and boat-based clinics. Micah, he's currently working with the WVU Prevention Research Center. Okay, So those are the great people that we're gonna hear from today. And just to get us started, I'm very curious person, and I want our three panelists to share a good memory that they have, perhaps the best memory that they have from one of the trips abroad. Who wants to start? How about Christina?
Yeah, when you asked me this, I had to really think, because when you ask anyone who travels abroad, what's your best memory? It's like, what kind of question is that? There's so many. So I picked one that relates all of them. So I was in Bolivia in 2016, my first trip abroad. I was 16 years old, and I was in the living room one of the first nights with my host family. And they said, "Do you want to watch the opera with us?" And of course, all in Spanish. They spoke no English. And I was okay at Spanish. It was high school level Spanish, so I was intermediate at best. And we watched this show called Jesus y los 10 Mandamientos, Jesus and the 10 Commandments. And he sat me down and we watched it, and I understood none of it. And then we started talking, and I found out that my host dad and I had shared ancestry. He was Middle Eastern, and he understood some of the language that my mom speaks, because she's also Middle Eastern. And I was like, what? I'm here in Bolivia and somebody else is relating to my culture. And so that relationship, I'll never forget. Me and Johnny watching the soap opera. That's one of my most fond memories.
That's awesome. Thanks for sharing that. Uh, I also would like to hear from Daniel. What's your best memory?
I think probably similar to Christina. I feel like the first time you go abroad, it's like, I don't know like how we like rate best, but it really felt like the first time for me was like that's the one that always stands out. And there's at least a couple people in this Zoom that have traveled with me, and I always say the same thing. It was Panama. It was the first time we had worked in that region, and we were in an indigenous community in like the deep mountain part of Panama. And so we had really we prepared for Spanish, and we had translators with us, and we got there, and they were speaking a more indigenous language, and so it was derivative of Latin and Spanish, but it wasn't anything that like I was equipped to handle. And during the first day, we pull up to our service site, and there's 200 people there, and I remember like just the sheer panic. And we'd been there for about an hour, and an elderly lady who was probably about the same size as my grandma. She was asking me these questions, and I knew she was talking about glasses. I could get that part of what she was saying, but I had no idea really what she was saying other than that. And so I asked her to come with me so we could talk to the people who were facilitating the clinic. And as we were walking, like out of nowhere, she grabbed my hand, and here we were walking, and I was really close with my grandma, and she had been, at this point, I think she had maybe been dead for about 10 years. And as soon as she grabbed a hold of my hand, I felt like it was like my grandma grabbing my hand again. And we walked like probably about 200 yards probably. And she like held my hand so tight the whole time. And like, it took everything in my power to not start crying. And once we got there, and I was able to get her some assistance, it just like, I don't know, like, in this country, we're so averse to human touch, and like, you never really see that or experience that. And I'm not necessarily a touchy feely kind of person. Like normally if someone like even wants to shake hands, I'm like, I don't want to do it. And so like, it was just like really nice. And I don't know, it just kind of took me back, and it was something that like I've experienced many times in the past. I mean, I think Beth can probably talk about, there's a house mom in Jamaica that like I'm still friends with. I talk to her almost every day, and it's been 2 years since I was in Jamaica. So like lots of those like personal, people kind of memories.
Mhm. Yeah, I love that memory. And I think that's the first time you go abroad, it's like for you, it's when you have all these great memories, and it's all about usually human connection. That even like with the barrier of language and culture, there's always that touch that you're gonna just remember that forever. Micah, I know that your experience abroad it's quite different. I mean, for those who don't know, Micah spent 11 years in Brazil, and probably the first time that you went abroad, you're 10, 11. You can speak more about that, but I'm curious to know what's your memory.
Well, yeah, this question's a little hard to answer because for two reasons. One, my memory is very poor, and two, my study abroad trip lasted 11 years. But I think that, putting this in the context of our topic today and thinking about it from some of the student interactions that I've been a part of and facilitated, I remember, and I believe it was actually Beth Nardella's group who went to Brazil for the first time in 2013. We worked with a women's health nurse. Her name was Lucy Clea. She doesn't speak a word of English, and our students didn't speak a word of Portuguese. But the students that shadowed her became really fast friends with her. She was beloved by all of our students. So it was really interesting, and I've never forgotten seeing, human interaction transcend the language barrier, and that was really interesting to see.
Amazing. Thank you for sharing that. And my next question actually goes to Daniel. And we have a lot of students here that they responded on the chat box that they've never been abroad and they've never done any sort of like a service trip. And how would you explain that concept of a global service and learning to the audience that we have here that they maybe have never heard of that term before?
Sure. I think I would, if we break this down and we just think of like, the two concepts of global and then service learning, it's like the idea of global service learning to me is, so every one of the classes that I've worked in, so, regardless of region, I've designed a course that's really related to the work that we're doing. So, like for instance, this year we were supposed to be in Greece in May, and it was a social change course. Pretty much all the Central American courses are a health and medicine course. And so like looking at like the sociology of health and medicine, I think it's significant really in many ways because like my field of sociology, we're able to kind of examine through our sister discipline with anthropology to kind of set a framework that people are prepared to be able to work in a global setting. And so like, that's really significant for me. And so I don't want to ever travel with a group of students who really know nothing about like the region that they're working. And so the course that my students take is always kind of foundational to that country. So we set up a background of the history, the culture that includes things like the economy, the government, family structures, religious institutions, and varying other institutions that play significant roles. So like health and medicine and healthcare versus like, like the history, like when we were in Ghana, like there was a particular focus on the significant history of Ghana and the Ivory Coast to slavery throughout, the world. And so, when we're in these regions, we facilitate, so we're working on a service project in one of these destinations, or a couple of destinations actually, is like what we typically do. We'll work, for about 10 days in like maybe at least 3 different communities. And we're working on a project. It could be anything from when we were in Jamaica, we were running a summer camp with the Amazaje team in Jamaica and the local community leaders. And like the important part of the global, particularly in the work that I do, is, we're not going in there as like, oh, here are the Americans trying to institute like their culture, their values, their norms, their beliefs, et cetera. Like we're working with our community partners, and that's really significant. So like, for instance, everywhere that we work, like a strong presence of the community leadership. And understanding their needs, so they're able to identify what it is that we can do to help provide them with, either resources or service projects or running a summer camp. And so the learning part of it really comes from the idea of like interacting in kind of an immediate immersion in a global community different from your own. And so Christina kind of alluded to this, but like she traveled with me to Honduras. And so like, I think on that trip that she was on, there was probably only about like maybe 5 or 6 people who were like even efficient in Spanish, like not even proficient. And so we have like partners, the community partners, like we have translators who help us to interact. So like leveling that, kind of engagement, but also kind of like definitely not going in there and imposing any kind of norms that are reflective of like our society on them. And so we did reflections every single night. And so like every night we were looking at like, what did we see today? What stood out to us? What is maybe similar to what's going on in Appalachia, in our region of the world, and kind of focusing on more the similarities than the differences. I think it's pretty easy in a lot of times to see some of the significant differences in some of these places that we work. But I wanted to look, like we try to like do our best to really focus on the similarities. And like, it's kind of incredible, the similarities that we find in Central America, in particular, like the work that we're doing in healthcare with the similarities to what we see throughout Appalachia. And, a lot of the same social problems are there. And so, but also like looking at the significant role of like family and like just how important family is, or any of these social institutions. And so really it's about like going in there with an understanding, at least at the most basic level, about what the country and the community and the history of that place are, interacting with these people on a daily basis and being able to communicate with them and get to know them and develop these relationships. And of course it's much easier if it's a language, if it's an English speaking country, but also reflecting with those people. And like we, all of the partners that we work with, like they participate in our reflections and stuff. And so it's nice to see like what they're going through and like hearing from them, like their perceptions of everything.
Thank you for sharing that. And I think you touched a very important point when you're talking about serving abroad, which is like the community side of things. And even domestically, service and learning, it's all about the nature of service and learning. It's always about a reciprocal relationship. I am learning something from this member of this community. There's something I'm learning happens to be tied to the academic content. So there's a purpose behind everything, every action that you do. And my next question actually goes to Micah. And Micah, you were on the other side of things. Like unlike Daniel was bringing students to Honduras and Jamaica and all these places, and you were hosting students. You were on the ground planning the logistics for these programs. And what are some of the misconceptions that some people, perhaps the students, might have when they go abroad that can really be, that it's not beneficial for the community and for themselves? And how you think we can combat like these misconceptions?
Yeah, that's a really great question, and I think Dr. Brewster actually mentioned a lot of it. In a sense that something that I've noticed, and I'm going to use the context of global health because it's the field that I did most of my service learning trips on. In a weird, in kind of an odd way, and I think that this tends to be something inherently and culturally American, but we do tend to develop a quote unquote savior complex when we go to other countries and cultures that we perceive as being undeveloped. And in a lot of cases, what we can see is, you have maybe a pre-med student get involved in a global health project and be in a clinical setting. And then all of a sudden that pre-med student forgets that they're still a pre-med student. They're still an undergraduate. They don't have clinical training. And, just because you're in another country doesn't automatically increase your your credentials or your competency. And so that's something that, especially in a global health context, we really try to balance out. And in teaching also the students that they're there to learn through service, but their service is not necessarily essential to the ongoing systems and projects that are in a community. They're there to learn through service. It's not a trade-off. They're not providing service in exchange for learning. And I think that's sometimes a common misconception that that I've noticed that students have when they go abroad. And you know, really the way that we best combat those misconceptions is through a lot of reflection. It's through a lot of conversation. It's through enhancing and building cultural competency in students before and while they're in the field.
Can I add something really quick there?
Yeah, sure.
Like, there's something that like actually like what you're talking about, Micah. It actually happens with our group. Like, our students will actually do like what you're talking about, where like they kind of get this mentality of like, I am a doctor, and they don't even do some of the things, and then they'll come back and they will literally go into their classes and on campus and say things like, I was able to do this. And I'm like, no, you didn't. Like, you didn't do that at all. And like, but they'll kind of give this kind of impression like they went down there and like they were this new dentist in this community. And so it's like, not only do they go in there thinking that they can do it, they come back thinking that they did do it. And so like that like creates some issues, because like a lot of times students will sign up for these trips thinking that like, I'm going to get down there and do things, or get to, you know, Europe and do things that I would never be allowed to do here.
And a lot of it comes from, you know, not wanting to go down a rabbit hole, because I feel that we could probably talk about this all day, but, you know, a lot of it comes from, I think, the culture of health science programs that encourage you to do things before you apply, encourage you to have certain experiences and things on your resume that you can say you can do before you even apply to certain programs. So, you know, whether or not that is a huge contributing factor, I don't know, but I think that's definitely one of the reasons I think that we see a lot of that. But really, I guess it's also a question of understanding dynamics and really understanding your place in an organization where you're assisting and providing services.
Thank you. Yeah, this was, when we can spend probably all day talking about this and this type of impact in the community and what the students bring back. And sometimes it's cool that you've been abroad, and it's kind of like cool to say that you did things, that you helped, but we also need to be very careful with the language that we're using when we're referring to people in other communities. And on that, and I just want to touch something really quick. We are in the middle of a pandemic right now, and we are very aware that changed the face of global education and global service and learning a lot. For example, some of the study abroad trips had to be canceled this year because of COVID. But I also like to think that students are being affected by this, and also our communities that were being served. And I think I would like to hear from Christina, because I know that you were heavily impacted with your plans this year due to COVID. And if you can also talk about, I don't know if you know the situation of the communities that you have worked with in the past during these difficult times, and if you could talk a little bit about that too.
So as you guys might have heard, I was supposed to go to Brazil this summer, and I was so excited. I found a Brazilian student on campus to teach me Portuguese. And when it was canceled, there's that first, you know, pang of, oh, me, my problems. But having studied abroad and experienced, you know, other cultures, it really does instill a sense of we're not the only ones in this world. A lot of my family is very preoccupied with what's going on in America, and that's important, but I always read the global news. So I was looking at the communities that I had traveled to from the news standpoint, as well as people that I made contacts with there. And I know that in Honduras, they were just completely ravaged by this Hurricane Eta. About 260 people have died in the Central American region, Nicaragua, Honduras, Guatemala. And so they're devastated by that, that environmental crisis. And then they've got COVID on top of it. There's still a lot of migrants trying to flee violence and destruction. And so what they're dealing with is, you can always say someone else has it worse, but having perspective is a very important outcome of global service learning. And like they were saying, what is global service learning? Well, it has that scholarly dimension of reflection. Who am I? What am I doing here? And Professor Brewster did a wonderful job in his class of making us very aware that we're not going down there to save anybody or cure anybody or leave this marvelous impact. We're probably benefiting more than they are. And like Micah was saying on his end, the accommodations to host these American students are extraordinary. They have to plan everything. They're worrying about our safety, our transportation, our meals. And so being appreciative and aware of what's going on in Peru right now, which is where one of the countries I went to in 2016, I don't think they have a president right now. There was kind of a coup d'etat in some of the largest protests that the country has seen in 20 years. So there's some political turmoil there. And Bolivia, their president was ousted. He spent some time in Mexico and then Argentina, and now he's back. So political struggle, environmental hazards, and then COVID. So they're worrying about quite a lot. A lot of these communities that accept students are juggling so much, and then they still show these students wonderful accommodations, kindness, and acceptance. So yeah, that's what's going on.
Very well said, Christina. And I think the concept of what means to be community minded has changed a lot. And we should always reflect on that and what that means for us as students as we're planning to go abroad maybe next year when everything is back to the new normal. And we have to have that in mind. And even now, last year, we thought that be community minded meant I'm going to go on this trip. I'm prepared. I know a lot about what's going on in this community, and then I'm going to go learn and help at the same time. But now be community minded means, do I really need to be out? Do I really need to be traveling, doing this and this and that? So I think it's a very interesting reflection for sure. And also I have another question for you guys, and that's for the three of you. Many of our students talk about wanting to go abroad and do service because they want to make a difference. And that's really great. How they can still make a difference in times like this? For anyone that would like to start.
Okay. Yeah. One of the things that, so we partner with Global Brigades, and they're doing telebrigades now. And so it's a online version of what you're able to do, and you're able to like see into, and it does, I mean, it costs money, but it's a virtual kind of Zoom experience where you're able to engage in one-on-one contact with local community leaders who are kind of giving you updates of what's going on. You're working with doctors in like some of the same ways that, we work in the country, of like being able to like, see patients, and it's in a more virtual setting, which is like, pretty much like where many of us still are with our doctors and our PCPs here in this country, where it's all virtual. And it does benefit the communities, because like what these brigades do is they're able to get supplies to the local community clinics and things like, for us, it's like not just over-the-counter medications, but prescription medications. It's things that like, we use on a daily basis that you can get at, at Kroger or CVS. But like one of the things that like I do with my organizations is like, we do a lot of work here in the community. So we have a partnership with the Pantry Plus More, which is a food pantry here in here in town. And, we've developed a relationship with Rourke Sizemore and his mom and Tom Bloom. And so we work in like this community. So like, COVID has ravaged Appalachia in ways similar to like it's, ravaged any area in the world. And so we are, like last weekend we were at this mobile food pantry, and I think we saw like 315 families or something. And so like, just finding service projects that you can do locally and like trying to make an impact, because, obviously COVID has changed everything. But we also, I think like Christina alluded to it, like we've developed relationships with a lot of the people that we've worked with over the years. And, like we talk to them and, hope to travel again, but like, trying to find things locally. Our communities need things too right now. And so like, if you can't get that, global immersion experience, if you could find things through iServe or even in your local home communities, maybe over winter break or something.
And I was just going to mention Amazaji is also doing some virtual service and learning programs. And a lot of organizations and agencies that facilitate global service and learning have moved to kind of a virtual model. But I think going back to the question is, where can students make a difference? And I just really want to echo what Dr. Brewster said is like, our own communities are suffering right now too. And there's a lot of opportunity to provide tangible assistance to the communities and the organizations around us. I know that for a lot of people, the focus is, oh, I want to do something global. Unfortunately, that's not a reality right now. And so looking for opportunities that already exist in your community is a great way to gain experience so that when travel is viable again, we can be working on building our own like interpersonal skills, but also our own like technical skills in order to be able to contribute more when we're allowed to do global service and learning. And I did just want to add just a note of caution that a lot of organizations have very specific needs, and they might not be exactly what you're interested in doing. Don't go into an organization with the tunnel vision of like, I need to do this. Their needs might be something else and also be something you can work with as well.
Good. Christina.
I would say, sorry, go ahead.
Just
I would
go ahead and answer the question. If you have creative ways you're a student right now that students could be involved in actively doing something, engaging with the community in times of social distancing.
Right. So from that student perspective, like my Brazil trip was canceled. So I'm looking at virtual study abroad options. And then if I don't go for any of those, I would recommend making yourself the best, most refined version of a global service learner that you can. So if you know the country or region you want to go to, educate yourself, learn a little bit of the language, work on your own awareness of the place so that when you do go, you're better prepared and you're, I guess, I don't like saying difference because you're not really going to transform anything, but your presence there will be more meaningful. And then find, if you really want to have some global exposure, find where the global meets local, like serving at the Pantry Plus More. I guarantee you'll hear more than one language spoken. I'm an ESL teacher, a volunteer at Literacy Volunteers in my free time, and that's a wonderful way to contribute to something and at the same time get connections and just practice that cultural interaction with people from different parts of the world. So find the global voices in your community and support those as best you can while study abroad options aren't happening.
Awesome. Now tying back to that first question when I asked you guys about like your favorite memory abroad. What is the best advice that you wish someone had given to you before you went abroad for the first time to work with the local communities? For the students that still have that desire of like when we finally defeat COVID and plan a trip abroad, what is that best advice that you wish that someone had given to you?
I think if I had to go back and redo my international travels, I think I would have told myself to maybe listen and pay attention more. Um, I think I was pretty focused on like goals and objectives and getting from A to B to C, and it really took me a while to like just kind of stop and just take it all in. So that would maybe be my advice.
That's a very good one.
I mean, I think if I were to say, so, I've had the opportunity to travel a lot of places. I mean, I've been to 42 countries in my life, and I think probably the one thing that I would say as it pertains to service learning is like I think that like one of the things that I'm gonna start instituting with all of my groups is like read something about the country that's like not an American version of like the research. So like I give my students a lot of articles that are written in American academic journals and things to relate to those areas. And like one of the things that we read for Ghana, like it was published in an American journal that had been peer reviewed, and then we get there and it was like so wrong. It was just so incredibly wrong. And like I kind of felt like we were kind of unprepared for that service project, because I'd done the exact same thing I'd done in every other country. But so I would like start searching. I mean, Christina alluded to it. I mean, she's so on top of it. It's like, go out there and start actively like trying to learn on your own. Don't wait for someone else to help find that stuff. I mean, the only other thing I would say is like I am like type A so ridiculous, and I have no capacity for like managing like when the plan doesn't go according to what I had like imagined. And like one of the things I've learned abundantly is that nothing is ever going to go according to plan on these projects. And so like being able to adjust and be a little bit less type A, and like particularly, I mean, outside of my Jamaica group was just go with the flow. Every other group I've ever traveled with was like incredible type A's who like they would struggle if lunch was served at 12:45 instead of 12 o'clock. They were freaking out. And so like being able to just like manage, like understanding that like things are moving at a different pace in many places in the world, different than like what happens on even a college campus like WVU.
Exactly, especially if you're planning on traveling to Brazil. Go with the flow. That's my recommendation for you. Christina.
So like everybody else has said so far, try to be a leaf in water and just go with it. It'll make your life easier and happier. So I would have told myself the best advice is you are there to learn. You don't already know. Be a sponge and break away from the group. And I'm still a student, so I still get that like social nervousness where you're in a different country and you see that group of, like in Honduras, we would be at lunch and I would see the Honduran doctors and nurses having lunch in their corner, and I had my tray and I was like, I really want to go sit with them. I'm so nervous. And I'm so glad I did, because when I think about what did I do on that trip, I remember sitting with them, them thinking I'm absolutely insane for not eating eggs or meat because I'm vegetarian or whatever. And we just had this little debate and it was so much fun. And so connect with people and just shake off the nerves because they'll happen. But what you remember is when you can overcome them.
Awesome. Yeah, these are really, really great recommendations. Now we have 15 minutes for you guys to ask your questions. So feel free to go ahead and unmute yourself. And if you don't have questions, you have a comment, you have an experience you want to share, we have time for that. And I really would love for you to participate and engage. And if you can turn your camera on so I can see your faces, that would be also really amazing. It would make me happy, actually. I miss the human contact.
I actually have a question for the panel. I know we've been talking about all the positive experiences, but do you guys have any that stuck out to you, or a place that kind of, I don't want to say negative experience, but something that stuck out to you in not the most positive way?
Christina, do you want to go first this time?
Yeah, okay. I feel like it's not something I like to do, focusing on all the negative things that happen. I just take them as like unexpected things rather than negative things. Um, I would say sometimes, especially being a Spanish speaker, when we travel, I have heard some negative things about um, like us, like the group. So I was in Peru playing volleyball with this group of people, and they were all from the local community. And they said things in Spanish like, don't pass it to the gringa or something like that. And you just have to take everything, understanding that they might have some preconceived notions about Americans, who you are. Sometimes who's in charge of your country in politics can reflect on you. So you're an ambassador, and every time you step out of this country, you're kind of representing what other people think about. And if they've had a really negative representation from, you know, the news media or maybe other tourists, because where I was, it was a village flooded with tourists all the time. I was probably one of the few people that had come there to work with a NGO and not to walk around the ruins and buy trinkets. So I just didn't take it personally. I played that volleyball game really hard, and when they found out I was decent, they were like, okay, she can play with us. And so combating those stereotypes by being a good, genuine person and that ambassadorship, it can help mitigate a lot of those negative encounters where someone is saying something about this group of Americans. Why are they here? Just, you know, show by example, lead by doing.
Awesome. So I see that we got a couple comments in the chat box, and I'm gonna ask Carrie to read it for me because you might not know, but I'm having technical issues and my screen went black for half of this conversation, and now it's back, but it's all blur and I can't read it. So Carrie, go ahead and read it.
This is from David. Professor Brewster, everyone on this panel has sort of hinted in this direction, but having worked with you, I know that on-campus critics of Global Brigades have frequently labeled it a volunteerist organization. For the benefit of everyone here who might have heard of anything similar, what is volunteerism? Why is it bad? And what steps do you have to take to avoid engaging in it?
That's a great question.
Yeah, I mean, I think one of the misconceptions really comes out of something I said earlier. Like, you know, our students will come back and say things like, I mean, I think that this is something that like we even do here. Like, you know, I hear students all the time kind of talking about things that they did in their jobs here. And I'm like, I don't think you did that in that job. Like, I don't think that that's necessarily like in the purview of that job, but it's like, there's no way of checking that. Right. And so that's something that I think has happened. So like some of our students have come back and they're like, you know, we were in these clinics and we were, you know, like, I'm trying to think of like something that they said, like, you know, we did this procedure, and like when they use we, I think a lot of people interpret it as if they were actually hands-on in this situation, and they just really, it was more so we, as in like, I was in this circle of people who was doing it and I didn't even have my hands on the, you know, the dental tools or on the needle or whatever. Volunteerism is when people travel abroad with the kind of the mission of like enjoying their trip and getting pictures and, you know, coming back with like a full body of Instagram pictures that they can post on, you know, for every day for the next 365 days about like how life-changing this experience was for them. And, one of the big things that we do, so we actually, Genesis Snyder, she's an anthropologist in my department. She gives a lecture for each of my groups traveling abroad on issues related to cultural relativism and ethnocentrism. It's significant. So like, these people will go abroad and like, they will get like, sometimes like really drunk, or they will, stay up all night, just kind of like, who knows doing what. And, like my students, like they've learned that that's not going to be okay. And, but we see that a lot with people who think that they're like really going on a trip. And like, I've never really had any students who done, like even Jamaica, like they definitely like gave us a lot of opportunities to enjoy our time and, like experience the culture and the foods and the people. But even there, the students that I traveled with just didn't engage in any kind of like, they were not complaining because like we didn't get to go to the beach today, because they understood that we were, working on this project with the Westmoreland people there in, rural Jamaica. And so I think that's a significant part, is just understanding that you're there to do a work. And, if you get to go and enjoy something like a beach or a waterfall or, whatever, that's just an added bonus, but that's not the purpose for the work.
All right, our next question. Is it easy for the STEM major students to study abroad? Because I'm a biology major and I'm still not sure to take this decision, and I'm already studying abroad since I'm from Egypt.
I can answer that question if it's okay.
Absolutely, fire away.
So I think just by the nature of who the panelists are, we have focused a lot on global health and global study abroad, but there are study abroad experiences that are widely available for almost every discipline. And also, just because you're maybe not a health focused student, I've had students go on my trips that are, history majors or, in a pre-law program. And they still have had really rich experiences because they've gotten to experience culture, they've gotten to experience learning opportunities. So I would absolutely say that every discipline, every major, there is a study abroad option for you. As far as being from another country, I think if you were able to go on a study abroad trip with a group of American students, you would add considerably to the dynamic of a group, just bringing a perspective that isn't necessarily American focused.
To add on to that really quick, so the majority of students that travel with me are either bio or they're exercise phys, and probably exercise phys more, physiology more than bio. A lot of them are, but we have a ton of students who are like social science and whatnot, and they actually a lot of times bring a very different reflection to the conversation than does others. I've traveled abroad with international students in the past. Our global affairs office here at WVU is just, they're fantastic, and so they can help to make that work, because a lot of times you have to like work with your embassy to allow for you to travel in those places, particularly if you're here on scholarships, and they can help to answer, or if you're here on funding from your government, they can help to answer those questions. And so I know we traveled with a Nigerian student, an Ethiopian student, I feel like one other country, and actually this past year we were supposed to travel with a Kuwaiti student, and their embassy would not allow them to travel. So they got accepted, they had signed up and everything. And so it's important, but Global Affairs Office, which is right across from Stewart Hall in the Puritan House, like they can help answer those kind of questions if you're more concerned about the international component of it.
You guys can check out in the chat because Shelby actually put all the contact information. So thanks, Shelby.
Thank you, Shelby. We have 8 minutes for more questions. If we have students here that have been abroad, if you want to share an experience, please feel free to just unmute yourself and contribute to the discussion. And I think we talked about something that it's, I think it was Micah and Daniel talking about pictures, like when you're going abroad. What is the overall kind of like guidance for pictures in these trips?
I think that, I mean, we definitely encourage students to have, meaningful experiences, interactions with community members. We also do orient them that like taking a selfie really isn't considered a meaningful experience. And also, a lot of the students, we have to remind them of ethics. You wouldn't want someone, some stranger walking up to your kid and taking a selfie with them and then having that picture go online. The same applies in other cultures and in other countries. So, kind of bringing them to a sense of, if you're not going to do this at home, or you wouldn't welcome someone doing it at home, you probably shouldn't be doing it in another country or another culture.
Yeah, I think that's a very important thing to talk about, because of course, when you go abroad, you wanna have these memories, like these material visual memories, and you wanna remember the face of the people that you're with. But I think it's always good for you to invest in that relationship first, and making sure that you have the solid relationship, and it's okay for you to ask if you can take that picture, and let the people know whether or not you're going to be using that picture for something. If you have to come back and make a presentation, which sometimes the students have to do that as a piece of their class, you just tell them, or try to find a translator to tell them, this is for a presentation, academic presentation, or this is for my personal files and all of that. But I think it's important to be mindful. Like, if you wouldn't do that here, so you don't want to do that somewhere else. Any other questions?
Can I say something really quick?
Sure.
One of the significant things too is to use people's names, right? So like, if you are going to post a picture and you've got that permission, use their name in a first name, but like, make them more than just like the little Honduran kid in my picture, right? And so like, that's significant. We take a lot, so University Relations travels with us, like a member of their staff travels with us usually. And like, they're professionals in the sense of like, she gets pictures that don't include people's faces, and she shares a lot of those pictures for us. And like, that's really important too. Like, you can get a memory of a space in a day without like putting people's faces in it, and doing your best to do that is important.
Okay.
I would just like to add that
sure.
One of the wonderful aspects of these trips is putting your cell phone away and just not worrying about it. So it's much more valuable when you're back to have a relationship with someone, maybe like a WhatsApp, or you regularly Skype your host family. That's going to last for years and years, rather than that random picture you have with the people whose first names you can't remember. So it's really nice as a student who's always on your phone and ringing, and it's just really relaxing to put it down and be present in that moment.
And just as a final thought, if you are in a position where it is perceived that you are providing service to a patient or to an individual, just be aware of the power dynamic. If you go on a lot of our, and something we orient our students on some of our global health programs, you'll see lots of pictures of them, of their fellow students, of the health team. You will very rarely see pictures of them with patients posted online. And going back to what I said earlier, because that's not something you would do if you're working in a clinical setting in the US.
Awesome. And if you guys don't have questions, I have one more, and this might not be the best final question, but I really want to know your thoughts about this. What white privilege has to do with service abroad or study abroad trips? How do you see those two linked or connected?
You want me to go first?
Sure.
I mean, I think it's incredibly linked. It includes everything down to you know, just kind of expecting a deference to people. So like, I mean, Christina and David and Shelby have traveled, and Nick have traveled abroad with me, and like a lot of my students, like they won't even learn statements like "excuse me" in Spanish, and they just kind of expect people to like move when they're like there, and it's kind of like, it's like, here I am, I'm wearing my Nike clothes, and you need to get out of my way, without me even learning how to say, excuse me. And so like that's something that we stress in my work is, like understanding, like, like we try to like make sure that everybody's at least able to communicate in some basic level of Spanish. But I think that has a lot to do with it. It's like kind of like the privilege of like, I'm here, get out of my way, etc. But like also like, like there are people who will loudly say things about the food. And so like, I try to stress like, we're going to be eating foods that are not necessarily like, I mean, you're eating beans for breakfast, right? And like, we're literally having scrambled eggs and, frijoles for breakfast. And, some of the students will be like, oh my God, beans again. And so it's like, just kind of like, I mean, like we've prepared them for it, but it's like they still kind of like turn their nose up to, some of like the foods that are offered there. I think also like Carrie's question earlier about some of the negatives, like we actually we've had some pretty trying experiences, and like I don't like to talk about them because they really come off as ethnocentric, and so like like a lot of people really abuse dogs in these regions and abuse animals in these regions. And like my students will literally like yell at people as if they're like in this country, right? And so like we had a student one year, like, I mean, like she almost got into a fight with someone because they had kicked a dog. And it's like, it's just, like you can't go into someone else's neighborhood in someone else's yard and yell at them for like doing something that like is maybe like, I mean, first off, you're in somebody else's yard, right? And so like to expect to be able to tell people not to do something in their own yard is very, very much like what we're seeing a lot of white women doing this in this country right now, walking into people's spaces. And so just like kind of breaking down that ethnocentric point of view is a way of like, kind of controlling that white privilege. But it does, and it's something that happens where like we expect things to go just like what we would see here, and it just doesn't necessarily translate.
Exactly. Anyone else would like to add to that as a final kind of like thought?
I think go ahead, Micah.
I just want to say that like these are good discussions, these are good interactions, these are healthy things, as long as you are, number one, aware of the privileges that you have, you're aware of the cultural dynamics that are in place, and you're open and you're willing to reflect and reassess internally. There are areas of privilege that you may not even be aware of before you leave the country. So just be open to rediscovery and revising your self-identification.
Awesome. Christina, final thoughts?
Yeah, definitely. You should take into account the history of what happened in a lot of these places. Sometimes enslavement and oppression, exploitation, just terrible things happened. And I know that you don't have anything to do with it, but people that look like you did. And there's still a lot of wounds to be healed, and a lot you have to think maybe these economic issues that the country is having are a result of current power dynamics that your country might have to do with. So just hold your judgment. I mean, like I said, I'm a vegan and I'm all for animal rights, but you can't go tell someone how to treat their wildlife in their home country. That's not right. So just reserve your judgment and be open to new things, but also don't be afraid to ask about it in a very respectful way. You can have these difficult conversations, and it's important that you do, just with a tone of respect and wanting to learn rather than judgment.
Awesome. Thank you so much. It's 5:02 and I feel like I could just sit here and stay for like 2 more hours talking about all these topics that I feel like they're so relevant. I know that you cannot go abroad right now. You cannot do a study abroad service trip. But my final thought for you, it's your study abroad trip starts here in your own country, in your own community. Try to understand what's going on. There's a lot going on in this country right now. And try to understand the history and try to understand your privileges that comes with your skin color. And then you go, as Christina said, do your homework and study about the culture and the history of the place that you want to go. And that's a really great start of your trip. I really want to thank you guys we have 40 people here. Thank you for your attention, and thank you to our panelists, Micah, Daniel, and Christina, for really contributing to this conversation. And I feel like we should do this more often.
Thank you a lot to the panel. I learned a lot too. I mean,
yeah, thank you. And with that being said, you guys are good to go. And this has been recorded. And if you want a copy of this, just send me an email. I'm going to leave my email at the chat box and I'll send that to you.
Lychee, can I add something?
Sure.
So just to the students who are here, I teach a global health class every spring. It's Exercise Physiology 235. It's currently full, but I'm happy to add any other students who want to take the course and go up. Since it's all online, we don't have a room restriction for the spring. We talk a lot about these issues in the class. It's also GEF 5, I think. So I'd love to have students who are really engaged in these topics and issues to take the course. There's a lot of freshmen in there right now. So to widen the conversation, it would be great to have students who are really interested in these topics. I'll put my email in the chat. If you're interested, just send me your 800 number and I'll have that restriction lifted so you could register. But yeah, thank you so much for this. This is a really great panel.
Thank you, Beth. And as a final reminder, if you signed up for this in iServe, just make sure that you go back in the system, you log your hours, and you're going to be granted 1 hour of engagement hour. That's how we are doing things this semester. We are not encouraging in-person service, but we are doing a lot things like this, panels and discussions. So just keep your eyes open to what's going on in iServe. Thank you so much and enjoy the rest of your day, guys.
thanks, Lychee.
Thank you, Carrie. Thank you.